Hello naturopathic beauties, I'm Dr. Stacy Shillington, Naturopathic Doctor, and it is my mission to help you get rid of your acne for good so that you do not have to deal with it anymore. That sounds good, right? Today I'm going to share my top 5 tips for visiting your dermatologist, and I'm uniquely qualified to give you these tips. I'll tell you why in a moment, but first be sure to like, be sure to subscribe. If you have any questions, pop them in the comment section below. So, why am I uniquely qualified to give you tips for visiting your dermatologist? I'm a naturopathic doctor. I've been treating acne for 14 years, but for 10 of those years, yes, for a full decade, I worked in one of Toronto's busiest dermatology clinics. So I really understand how dermatologists work, and I loved the dermatologists that I work for. Super awesome people. In fact, one of my best friends in the world is a dermatologist. So I'm not one of those naturopathic doctors that hates dermatology, but dermatologists and naturopathic doctors definitely approach acne differently. As a naturopathic doctor, I see acne as a symptom that something else is going on within the body, and we need to balance the body and heal it in order for the acne to resolve. A dermatologist, on the other hand, sees acne as a symptom that needs to be treated. And they have so many tools in their toolbox to treat that acne. They have different medications, topicals, lasers, blue light treatments. The list goes on. So we approach acne very, very differently. And I totally understand some people would rather see a dermatologist to treat their acne than a naturopathic doctor. So I am going to give you some tips on what you should do when you visit your dermatologist the next time, because it can be crazy. A lot of people get trapped in that loop of going to the dermatologist, and you're kind of on a hamster wheel of trying different medications, trying different topicals, nothing's working. You're just kind of like spinning your wheels. And when I worked at the dermatology clinic, I was always given the patients that had tried everything and nothing had worked. The most difficult patients, of course, but I loved it because these patients would come in to see me. They would feel hopeless. They would feel, like they'd tried everything and they were destined to live with acne. And, it was always so satisfying to, turn that desperation into empowerment and teach them, how to heal their body from the inside out, and teach them my philosophy that acne is a symptom that something deeper is going on in the body. And my philosophy, by the way, is backed up by tons of scientific studies. Just had to point that out. Okay, anyways, enough about me practicing as a naturopathic doctor in a dermatology clinic. That was super fun, loved it, learned so much. But I want to help you get the most of your time with your dermatologist. So these are my top 5 tips. Number 1, go into your dermatology appointment being educated on the root causes of acne. Know what causes acne. Insulin dysregulation, poor stress management, poor digestion, poor detoxification. Some dietary choices might be contributing to your acne. Microbiome imbalance. All of these things contribute to acne. All of these things are also backed up by a lot of science at this point. So when you see your dermatologist, ask questions. Don't just settle for an acne diagnosis. You want to know what is actually causing your acne. Okay, that's my first tip. My second tip is to do blood work. Insist on getting some labs done. Don't just settle for androgens and progesterone and estrogen, because that does not give the full picture of what is going on. That is only, again, that's a symptom. You're working at the symptomatic level. You want to find out the root cause. What is causing you to have high estrogen and low progesterone? What is causing your androgens to be high? That's what you want to investigate. So you want to test, investigate your insulin, for instance. You want to test markers for PCOS. You want to look at cortisol levels. Perhaps your dermatologist can even assess your microbiome in your gut. There's so many great tests for that nowadays. And basic vitamins and minerals as well. So insist on doing really thorough testing with your dermatologist. That is number 2. Okay, number 3 is once you've identified what's actually causing the acne, ask your dermatologist what his or her strategy is. And this is important. You want to know what treatments they are giving you and why, and how those treatments are going to help address the root causes of your acne. And ask these tough questions and make sure that you are comfortable. Ask how long the treatment is going to take before it starts to work, what the side effects are, what happens when you stop the medications, because often with many of these acne medications, your acne comes back even worse when you stop the medication. So, be very, very clear on what the full strategy is. And also, if your dermatologist prescribes you a treatment and it doesn't work, ask them what their next plan is. So, this is, you have to be an advocate for your health. You have to ask the questions. You have to push the healthcare practitioner to really deliver. Okay, number 4, insist that the recommended skincare does not leave your skin red, irritated, or raw. This is important. Often I see patients, they have a skincare protocol from their dermatologist. Often it includes retinols, retinoic acid, or benzoyl peroxide, and their skin is a mess. It's red, it's raw, it's irritated. Do not allow that to happen. Keep going back to your dermatologist until you find a skincare regime that does not compromise your skin's health. It can be done, whether it's switching products, using them at different times. Keep on that. Do not settle for really awful, irritated skin. It's not necessary. And number 5, if your dermatologist is not interested in helping you identify the root cause of your acne, if they're not interested in doing the tests that you are asking for, if they're not interested in coming up with a strategy with you and, explaining, what he or she hopes to accomplish and how, find a different doctor. Because there is too much research out there. I mean, one of the big red flags is if your doctor says your acne has nothing to do with your diet. Huge red flag. Find a different doctor because there's too much research that really correlates acne and diet. So it might take some time to find the right dermatologist. If you're not having any success, if you're trying different medications, they're not working, they're irritating you, the side effects are too much for you to handle, you may want to try a naturopathic doctor like me. I can help you, I promise. But anyways, I hope these tips help because I know so many women are visiting their dermatologist. They're getting frustrated. You need to become your own advocate. You need to educate yourself. You need to ask for tests, for investigations, for strategies, and you need to work with your healthcare practitioner to really get clear skin and be successful on your clear skin journey. And if you are interested in clearing your acne from the inside out and even just educating yourself more on acne, my 7-week clear skin program will be available in a few weeks. So click the link below to sign up for the waiting list. Get on that waiting list so you're the first to know when it's available, and also you'll learn more about what it actually includes. So that's it for now. Sending you tons of love. Tons of good luck at your dermatologist's office, and they want to help you just as much as I want to help you. They just have a different approach, and it's up to you to decide which approach works for you, whether it's more the treatment approach or if it's the approach where you go in and actually solve the underlying problem. All right, guys. Mwah. Have a wonderful, wonderful week, and I'll be back next week with some other topic that I'll think of in between now and then. Bye.